Thank you, Dr. Sharmila, uh, for all those nice words. And are my slides seen to all of you?
Yes, ma'am, it's visible.
Yeah. At the outset, I would like to thank the SRM University Medical Education Unit, Dr. Logaraj, the coordinator, and the administration for having invited me and given me a chance to do this. I also wish to thank Kilpauk Medical College, from where I graduated and which saw me transform to a medical educator, where I worked for 12 years, and I am in MMC for the last 3 years. I thank Dilara ma'am again, who is again from SRMC, which is my alma mater when it comes to medical education, because I did my basic and advanced courses there. So coming to today's topic of effective implementation of self-directed learning in undergraduate medical education. As we all know, self-directed learning is something which all of us are trying to implement. In fact, it is being implemented even before, we formally knew that this is self-directed learning. From the time we were learning, also self-directed learning has played a very, very important role in shaping the medical student. In the learning has been, complemented by SDL. Whatever the classroom learning and teaching is always complemented by SDL, and in fact, it plays a major role in bringing the desired output in a medical graduate. So going to the formal, definition of SDL, this was given by Malcolm Shepard Knowles. We all know him as though he is not a doctor by himself, we have taken a lot of his adult learning principles. He's basically an adult educator who was in Harvard, who worked in Harvard. And most of what we have learned today, we are practicing today in medical education is from, he's an important contributor to it. So according to Knowles, SDL is a process in which individuals take initiatives with or without the help of others to identify their learning needs, formulate their learning objectives, identify resources required, choose and implement appropriate learning strategies, and finally, evaluate learning outcomes. It is learning by the student for himself, and also he is the evaluator. So it's completely a learner-centered learning. So why has this SDL got so much importance? Thanks to the MCI and the NMC. And this is one of the important roles that the Indian medical graduate should possess. So one of the 5 roles. So the clinician, being a clinician, leader and member of healthcare team, communicator, lifelong learner and professional. So the role of a lifelong learner can be achieved only if the student is able to do SDL, self-directed learning. So this eventually makes him a lifelong learner, and knowing that medicine is an ever-evolving science, and the learner has to be flexible and plan his learning throughout his career. It is just not going to be limited to his undergrad or post-graduation days. Let's talk about the advantages of SDL. So when I talk about the advantages, this is basically, I have taken this from the systematic review of literature done by Archana et al. And was based on the research papers that have come, because as Dr. Sharmila at the outset said, we don't have a structured thing, and we are in the beginning, I would say in the early stages of implementing and evaluating SDLs. So all these things have been taken from her study, Archana et al. Study, and the main advantage is motivation. So here the learning takes place for the sake of learning. It is not, so it comes, the motivation for SDL basically has to come from the student, from the learner. So, and not only that, it also promotes time management, because the learner knows that these are the, this is the time available. So he has to plan what he has to learn, what are the resource material. And so this, in the process, time management improves for the learner. And it is very important in identifying skills that are required, especially the skill of getting the resources. And then there's scope for self-assessment, Because in SDL, we don't pay much attention for, I mean, I won't say we don't pay much attention. In fact, that is one of the best things about SDL, because there is, the liberty for the student, because this is not, for an exam or something like that, where, because our students are very good at cracking exams. So cracking exams and passing exams is a different thing, and learning for the sake of learning, for the subject, for knowledge, for implementing it, for patient care is totally different, is different. It has to be in fact parallel, but what we see in reality is the sake of, for the sake of learning. Hello. Okay, can I continue? All right. So for learning for the sake of learning happens because there is not much assessment here. And many students have found this as an enjoyable experience. And of course, this improves critical thinking because students are able to identify the knowledge gaps when they learn by themselves. They know where, the inherent gaps, which in fact promotes not only critical thinking, but later on promotes research also. And the students get very familiar with teamwork. This has also has come out from the studies as a very positive effect of the SDL. In addition to this, I would like to say that there is greater retention after a student has done his learning himself. So they're able to have it for life, and it definitely, the continuation of this helps him to be a lifelong learner. So now coming to the stages in self-directed learning. First is the readiness to learn. So the learner has to go through these 4 stages for him to achieve a final, a complete SDL. So step 1 is the readiness to learn. Here, the student first has to evaluate himself, his current situation, his studying habits, his situation at the house, like family situation, or how is the situation in the hostel. And he has to evaluate his support network. And he can also, he has to tailor make it depending upon his past experience with independent learning. So once he understands that, he analyzes all this and he sees that there are some signs, he recognizes the signs of readiness, which include being autonomous as a person and being organized and self-disciplined. He thinks that he has all this, then he is ready for self-directed learning, or he has to develop these qualities of being autonomous, organized, and self-disciplined. Only then he or she gets ready for self-directed learning. And the next thing is setting goals. Setting goals, this again, the student and the learner and the facilitator should communicate the learning goals. The facilitator should communicate the learning goals to the student, and together they have to come up with a plan, how to structure it and how the sequence will happen. And they need to set timelines, certain timelines for completion of activities, and decide about the resource material. So that will be the next step. So going to the third step, which is engaging in the actual learning process, the students need to understand their approach. They basically, learning has 3 approaches: a deep approach, a superficial, and a strategic approach. The deep approach is understanding ideas for yourself from the student's point and applying knowledge in new situations. So this requires a deep level of learning and learning more than what is required. So this is just not, what is required for passing the exam, etc. And a person who is a deep learner is an ideal candidate for self-directed learning. But we also see many of our students have the superficial approach, which involves only reproduction, helps in completing, like I have finished the portions, that kind of attitude. And the third thing is the strategic approach, which many of us, including us and the students, are very good at. They want to achieve the highest possible grades with just enough preparation. So this requires an extra intelligence for doing this, but this is okay for scoring marks in exams. But what we require for a lifelong learner who will be able to apply whatever he has learned in his day-to-day practice is deep learning. So, and a deep learner only will be able to do the SDL in the right way. Okay, the next step is the evaluating the learning. This is again, as I said, we are not going to have real formal assessments most of the time, but of course we do have. I will come well on it when we come to it. So the student has to engage in reflection by asking questions like, how do I know that I have learned? Can I apply my knowledge? These questions he has to ask himself and reflect on it. Do I have the confidence in explaining the material to others? Can I teach one more, somebody else also? Have I learned enough to practice on my own, or to treat patients on my own? Or when is the time to consult a faculty member when I feel that I need more help? So these are the things the student should be able to evaluate about himself. Okay. So once, the next thing I would like to tell is about the learning. There are 4 learning models. So Gerard Groh has given us this. And in the first stage, see, this depends upon the type of student. And these are not, these are not, they're not like compartments. A student who is now considered to be in stage 1 will move on to another stage. So this is, in fact, I would say the transformation that happens in the student and the kind of teacher the student expects to have. If there is a mismatch, like if the student is in stage being a dependent student and he gets a teacher who is like, a teacher for the stage 3 who's like acts like a facilitator, the student might not be benefited by that. So we have to see that the student and the teacher match. The student's requirement is matched by the type of teacher. All right, coming to stage 1, here we have the student who is dependent and the teacher has to be an expert. The stage 2, here the student is interested. So he is looking forward for a teacher who is a motivator. And the third stage, where the student is involved, he looks at a facilitator. He needs a facilitator to be his teacher. And the fourth one is a self-directed student who is capable of, who's himself self-directed. So he requires a delegator. So that is the quality that the teacher should have. So we will move from each stage. In stage 1, as I said, the student is dependent. So he expects an expert teacher, and most often this kind of, an informational lecture is an example of the teaching learning method here. And what really happens here is spoon feeding. So the information is fed to the student, but we don't have to think that this is not a defect. Because many of the student who eventually becomes a self-learner can be in this stage sometime, so these are not like they move from one stage to another. So we have to understand that. So I would again say that it's not a defect and it's not permanent. These students have the advantage of, most of them will be systematic and disciplined students. So, but the thing is they lack the relevant knowledge and skills and experience, and of course the self-confidence also. So they require a teacher who is like an expert in the subject, but at the same time, if the teacher just stops there, there may be some pitfalls. Like it can be too much of a controlling, situation, and the learner initiative doesn't happen at all. So sometimes when we have very good teachers, that's a problem. And it enhances dependency. So the student might continue to be dependent on the teacher. So we need to be very careful, and the teacher. So they should try to move them to the next stage. So that requires encouragement, warmth, and support from the teacher. The teacher, in fact, has to tell a few things that, what you have learned, the learning has happened because of your efforts also. The teacher should correctly recognize which part of the learning has happened from the student's initiative and help and encourage it, so that he becomes a little more confident and moves up to the next stage. So the next stage here, the student is interested. So he is looking for a motivating teacher. Okay, so we can have examples of such sessions will be inspiring lecture plus guided discussions. Here, the learners, as I said, are very interested or interestable. So initially they might not have the interest, but once the lecture is inspiring and the teacher is a motivating teacher, they come to the stage where they are interestable and these people respond to motivation. So here the teacher not only brings the enthusiasm, motivation to the class. So many times we have seen very tall teachers, like very charismatic teachers who influence us really well. So in addition to sweeping the learners and keeping the excitement alive, these two teachers have extra duty to take them to the next stage where they have to provide direction. Like, okay, this is right. This just acts as a motivation, and they have to continue the motivation so that they give them a direction and reinforce the learner's willingness and enthusiasm. So here, to move up to the next stage, the students should be trained in goal setting and realize, for that they have to realize their personality type and learning style and set goals accordingly. So once we are able to go beyond the class and go beyond the keep the enthusiasm alive beyond the classroom and motivate the students, we can surely take the students to the next level. But if we as teachers fail to do that, it might end up being an entertaining class, but leaving the students with little learning skills beyond the class. So that is one problem. Okay. Now, as we go to the third stage, here the student is involved and he requires a facilitator. So from the interested student, we have got the involvement into him. So the involved student looks for a facilitator, as I said. So good examples of such sessions would be group discussion and collaborative group work. Here it is like truly andragogical, and here the facilitator is like one among the group. So of course, though he has very set clear roles, so he gives a what do I say? It sees that the participants do their own learning, okay, and they are responsible for their education. And we have to keep a very happy and friendly working group to make the outcome of this stage successful. Here, learners can develop critical thinking and they can have their own individual initiatives. And we can see a paradigm shift from the type of learning that they have had. So a well-conducted, well-facilitated group discussion is just an example of this. And here the teacher comes closest to the learner in the learning experience, though most of the learning happens by the student himself. How do we move them to the next stages? Like we have to, here one problem I would like to say is the student is very comfortable in this group, but we should see that he gets comfortable in the real lifetime situation or with any other groups, or any other person, he has to collaborate later. So the possible pitfall here is if the teacher just accepts anything and values anything that any of the group members say, the students may not show respect. So you have to be very neutral and say just not accepting everything, promote critical thinking among them. So in which case the group is going to be very effective, and the learner will also progress to the next stage. So all he requires here is encouragement and empowerment so that they are not freaked out in real life situations which they are going to face in the future. So they should be able to be comfortable outside the group also. Okay, now the stage 4, here the student is self-directed. So the teacher has to act only as a delegator. So example is like an internship, and when we ask the students to do dissertations, here the role of the teacher is more of a mentor. So here the goal of the teacher is to keep him in that stage. In all the other stages, we always wanted our students to move up the stage, but here we have to see that the student is retained in the stage, and the ultimate task of a stage 4 teacher is to become unnecessary. Okay, but he should always be available as a mentor, meet regularly, and encourage them to work with others and do self-evaluation. and we need to stay far away from them, but monitor their progress and be available for consultation. So we need to be unnecessary, but we need to be necessary also. So that is the role of the teacher once we see that our students have to the self-directed stage. Okay. So I think this is all about how we need to, understand that these are the theories about self-directed learning. And let's move to what the methods are. So we basically have self-directed learning can be facilitated learning and self-paced learning. Most often, as for undergraduates, we will be doing the facilitated learning, where there is always a facilitator for whatever method we use. The most common one, there are many methods. I would not say common. One of the methods is the audio-video lectures. Here, this is also called as, we sometimes use the terminology for recorded lectures also. Here, it is pre-recorded voice of the teacher with relevant texts and videos. And but the problem here is, like, when we do a pre-recording, and teachers also need the feedback of the students as we are doing the class. So when it is not there, sometimes we tend to go overboard, and we can sometimes make it very overwhelming for the students, where there is a cognitive overload, be it auditory or visual also. So that's one problem. But having recognized this problem, the study results which were done this kind of audio video lectures were evaluated, students found 50% of the students found that they did not facilitate learning. So that is one problem with these kind of recorded lectures. So the next method is flipped classrooms. Here again, we are using a recorded lecture where the student listens to the lecture at his residence, and the discussion about the lecture happens in the classroom the next day. So this is like an improvisation of just the recorded lecture. So the discussion of concepts. So that's why we call it flipped classroom, where the actual lecturing happens in the residence of the student. So this is a good method. Next, we come to the small group discussions. And the MCI and NMC have given a lot of topics which have to be covered by small group discussions. And in fact, this is the very important method that we all have to rely if we have to achieve our CBME, when our students have to achieve all the competencies. Okay, so in the small groups, we have 6 to 8 learners per group, ideally, and there is should be a facilitator. So all of us in medical education are quite familiar. I just don't have to go to all this, go through all this. But anyway, the students have equal opportunities to speak and put across their partially formed idea, because the topic is given before, the reading material is also given to them before, so they come prepared. So they have some idea they have a partially formed idea about what they're talking. So we agree or disagree. The group agrees or disagree without being, without dominating any ideas. So ideally, the facilitator starts off with open-ended questions, and then we can introduce many things into it, like brainstorming can happen, bus groups can happen within the groups. All this is also permitted. So this is a very effective method. And next is problem-based learning, which is essentially a small group where we give trigger material, which can be which we call as a problem. The trigger material can be a paper-based clinical scenario or a lab data. It can be even photographs which the students can reflect upon. It can be charts, videos, anything. So this allows for knowledge acquisition through combined work and intelligence. So because the entire group's intelligence, is imbibed, so that helps. So problem-based learning has been there from the 1960s. It's not a new thing, but how well now with the newer concepts, we are using more of this. So problem-based learning and case-based learning is also similar to this, and where a case is given instead of just a paper case. And then team-based learning, where we have seminars, projects, which we usually do. Like for a long time, we've been doing this even in medical colleges here in our country. And student seminars and projects, they have have a big role. Now I would like to introduce what this donut rounds are, because we are not so familiar with these donut rounds. Donuts are nothing but, we just have, small groups where students are made to sit in 2 concentric rounds. So that is, or we can even choose to give our students donuts as, prizes. I mean, I'm just joking, but otherwise donut just says it's 2 concentric rings where a small group of students, like the students posted to an intensive care. It can be interns or even students or labor ward. In such settings, we can do it, where the students have to choose their learning material, and each one is they choose the learning material, they do the learning, and then they are asked to come up with about a set of questions, say about 10 or 12 questions, based on the readings which they did in the at home, and they pose their questions to their colleagues, like 2 concentric rings, I said. So the each one facing each other. So the student sits, the inner ring students sit facing the outer ring, and they ask one question to the person who is just opposite to them, and they try to get the response, and this person who is answered can also pose another question, and once that is done, they move. So the facilitator here observes everything. He's just made observes everything and see that this is like a reality game show. So here the learners' experience is very good. They're very happy with this kind of learning, because there's scope for a lot of and there's competition also among them, and so they want to do a good work. And the facilitator preparation is not really much. So he has to see that it all happens well. So that donut rounds, studies have said that the students are happy with donut rounds, because even after many months after conducting these rounds, they seem to have, they seem to be feeling good about it. And the last method that I would like to tell here is open book examination. This again is here the students are given questions. They have to look up the books and answer. So a lot of learning happens, but then this is time consuming, but a very, very effective method. Whatever they have learned, because they refer for one particular answer and from many books. So this will help them retain it for a long time. Okay, self-paced learning. Again, this, I'm not going to say so much about it. There are so many online courses, and we have the learning management system. Learning management system, and of course, digital books. Learning management system is not only for, the medical education. We can use it for many, it is a software application for the administration, documentation, and tracking, and of course, reporting also. Where Dr. Sharmila was saying that I'm in charge for the Makkalai Thedi Maruthuvam. Makkalai Thedi Maruthuvam is, we are monitoring it. It is an app-based thing. So we are able to train even the women health volunteers who are grassroots level workers, who are just with the secondary school education. We are able to train them in using this app by using the learning management system. So it is not only for medical education. We can use that for many trainings also. So this is one thing which we have some experience. Here the app tells us how well the student has progressed and the need for retraining and other things also. So there is the learner themselves are able to evaluate, to understand their position, and they can take it again also. So there's a lot of flexibility with the learning management system. Of course, the digital books are also there. Okay. Now having talked so much, so what are we doing in the Institute of Community Medicine at Madras Medical College? So these are, in fact, I got these, many of our assistant professors and professors are doing it in their classes. As I said, self-directed learning, the terminology only was not, is like kind of new, but all of us have been doing this for many years in our own ways, right? So we give creative assignments. We give some assignments like, sometimes we tell the learning material, sometimes we give it to them, and we follow it up through WhatsApp groups. The faculty gets it. The students have the leisure of submitting it at, we don't tell them that within one day or so before the next class you need to submit. We don't tell them that. We give them the time and space, but we follow it in the same WhatsApp group. And every assignment that comes back to us is, we read it and give feedback to the students. And using Google Slides, like what we do is like we give, this is like for spotters, and we give photographs of personalities and any photographs for that matter. We give it to them, and they have to find out about this, and they make it in as a Google slide and send it back. This not only becomes a learning experience for the student, it becomes a resource material for not only for that student, for other students as well, and of course the department also. So this way we are able to get, we have a real treasure of that we have collected from the students. And of course, during field visits, being in the community medicine department, we take students for field visits and small things like when we take our students for primary health center visits, we break them into small groups. Instead of the facilitator or the teacher who is going from assistant professor who's accompanying them, telling everything about the primary health center, we make them into small groups. One group visits the ICTC, one group visits the pharmacy, one group visits the NCD clinic, and like that. So they have to interact with the people there, who in turn act as the resource person for that particular group. They find out everything that they need to ask about their work, and how, for example, ICTC means what are the different tests that are being used, how many patients are being seen, what are the counseling methods that they do. All those things they gather from their the person in charge. And once that is done, we collect all of them, and of course the others get to see the rest of the others also get to visit all this. And finally, there is a discussion by each of these teams tell about, like this ICTC team will be sharing whatever he or she has learned with the rest of the batch. So that is how we are doing our field visits. And another next thing is the Pecha Kucha competition that which we held for the house surgeons, CRRIs. Like for every batch of CRRIs we give them, for example, I will talk about the Pecha Kucha competition for vaccines that we had. So each of these, house surgeons, we have about 50 house surgeons posted in our community medicine department at a time. We divide them into batches, small groups, and they have to talk about one vaccine where they do the preparation. But in Pecha Kucha, this is a Japanese terminology. This is Japanese method actually. They have the slides are they move on to the next slide on their own. There is a time limit which is set, preset, and the slide automatically moves. So the students have, in addition to learning about the subject, they learn effective communication skill and time management. So that also happens. So once all the team members complete their presentation, and finally we have the evaluation and all that, and we appreciate the best performers. So Pecha Kucha competition has really been a very, very successful thing, because students seem to enjoy it. Though we have not, I think we have to start evaluating that also, and I think that would make a good, we can disseminate our findings with others, which will be a good resource for medical education. So Pecha Kucha competition is one, and the next thing is very, very simple things that we do is like discussion about news of the day. Like we have news about vaccination or a new variant coming, whatever. We share it with the students, and here again, it is we don't tell them we don't tell them you need to look up all these and come back, nothing like that. The students themselves try to look up more information about that, and they share that within the WhatsApp group, which we have for them. So we have batches from first year to interns. So each batch has groups, and we see this thing very actively happening in the groups. So that way students get updated, and they, and we also get a lot of updation from them. Okay, now coming to assessment of SDL. As I said, the good thing about SDL is, we are not assessing it, in many of the conventional methods. But sometimes assessment is also required because SDL being an integral part of our, CBME, we need to have some kind of assessment, but we can have it, this SDL, there is deep level of learning happening here. So the concepts, it takes them to the higher level of cognition. So I would suggest, I always feel that this should be part of the summative assessment, where the questions have to be an essay or a short note, long answer type of questions will be very effective in assessing the depth of knowledge which they have gained through SDL. And of course, very innovative methods, like for small, the classroom sessions, we can have crosswords and other things which the student themselves develop from their learning. Okay. Now, what are the challenges in the implementation of SDL? So as I said, it is not assessment driven. It is entirely the student, I won't say entirely, lot of responsibility is there in the student, in the learner. And so we all know all 5 fingers are not the same, and our students are not at the same level. So some may be in stage 1, some may be in stage 2, some may be in stage 3, and some in stage 4. So there is a lot of difference, and how to have a uniform method is a challenge. And we need to have a lot of faculty involvement in this. We need to have a lot of faculty to do this, numbers also, and the involvement and the creativity of the faculty has a very, very long way in, goes a very long way in implementing good SDLs. And we need to look at the influence of the culture. When I say culture, it's the learning culture of students. So they have, because we know that in schools, there are a lot of, influenced by the training centers, coaching centers and all that. So students are so used to that kind of learning. So when we give them a democratic way, and when the resource is unlimited, they find it a lot difficult also, because they're so used to spoon feeding. So take them to different levels above that is little challenging. And we all know our students are very young. They come to medical school at a very young age, like 17, 18. And the distraction due to technology, I would not just say just the age alone. Even for us, it is there. So technology can be very distracting. To get them back on track and using technology for learning can be a challenge. And the next thing is the complex topics, especially when we have to learn a skill. That is difficult through self-directed learning. But there are some, even ultrasound training has happened through online platforms. So it is possible. I think we have to work more on that. And as of now, skill is a little challenging. Imparting, skill is a little challenging, but I think it can be worked out and it will be done in the coming years. So, and instruction, the role of the teachers, as I said, is very important. So the instructions have to be very clear, at least especially for a student who's in the beginning stages. So the we have to clearly communicate what we expect of them and how they have to do about. But later on, as they become experts in SDL, I think our role, naturally, we have to start withdrawing slowly. Be available, but start withdrawing. And of course, there may be issues related to teamwork. If it is a very good team, if the dynamics among the students are very good, then it makes it easy. But if there are issues within the team, then it becomes a challenge for us. And we also have to see, since students are in the process of, they're evolving, they may not be having organizational skills. So that requires, that we have to take the role of the parent. So though we don't like to do it and we are not supposed to be doing it. So we have to see that we have to spend more time and find out, and correct it if they don't have organizational skills, and support them also. So these are the challenges that we have seen. And I would like to tell about this terminology called SDL readiness. See, SDL cannot be like, the student has to be ready. As I said, most of the burden is on the student. So from the passive learner that he was in school, he has to adapt himself to this kind of active learning. So there is a lot of preparation from the student, and we need to know whether the student is ready for SDL. SDL readiness is the extent to which the student has the ability, attitude, and personal characteristics appropriate for SDL. It depends upon the creativity, love for learning. So again, he should not be, he shouldn't have landed up in a medical college for other reasons. He should have landed up for the pure love of passion for medicine and the love for learning. And if it is not there, it should be cultivated. So that depends. I mean, that, love for learning is a very, very important factor for SDL readiness. Initiative and independence in learning. So some students, some kind of curriculum in school stimulates this. But as I said, most often they have the pressure of, breaking a very, very high cognitively loaded examination like NEET. So the openness and the initiative for independence in learning doesn't happen in school. So that should be there. If the student has that attribute, it becomes very easy and he's ready for SDL. And he should take responsibility, he or she should take responsibility for one's own learning, and the self-concept should be there in the student for being an effective learner. So they should be ready to develop their problem-solving skills, and they should have a positive orientation for the future, which again, that kind of environment we should also provide. So all these are there, then we know that our students are ready. So there have been a lot of studies. One very good study, I think that I've quoted that in the reference by Kalyani et al. From CMC Vellore, which has really studied the SDL readiness among medical students. It was done like extensively. They have grouped the students depending upon the year in which they are there, and a mixed method study. A lot of inputs I've taken from that only. So based on these studies, what are the factors that promote SDL? The year of study. So we would consider that the higher year students will be more ready for SDL, but on the contrary, the freshers, as they enter college, were more ready for SDL, and the SDL scores decreased as they went to, as they advanced in their course. So this is one thing we need to keep in mind. So how to keep the fire in them to learn burning is again going to be a challenge for us, but we need to remember that students are much ready for SDL in their first years. So when the topic is well explained in class, especially in an interactive session, the student, the readiness increases. So that promotes the SDL readiness. So the interactive sessions play a major role. And asking questions in class, I said, this is very important in motivating students. So we need to keep asking questions. Even if the student has not answered in the class, that promotes thinking. We need to ask questions which promote thinking, and so that they go, and the relevance of that should also be, we should be able to make them understand the relevance of the question. So automatically they go home and start doing their self-directed learning. And practical case discussions promote self-SDL more than just theory. So they have to see, we all know they're adults, so they have to see the reason. So practical case discussions really help to promote SDL. Looking at the factors that deter SDL, assessment, our tests, internal assessment tests and all, they just want to pass the tests, or their aim there is just for getting marks or grades. So as I said, the learning for the sake of learning doesn't really happen. So assessment is a deterrent. And not another thing is, during the clinical rounds or clerkships, a student, when he is not adequately questioned, is also a deterrent, because we don't stimulate them more than in the class. During the case rounds or ward rounds, or during their OP postings, we should ask them relevant questions. So the student, but when we fail to ask it, that is a deterrent. And as I said, the age and maturity at the time, the time of admission to college, what they found was students who join medical school later, like after graduation, who have done some kind of, college before that and come to a medical school, they have more maturity and they're more ready for self-directed learning. And the learning culture, as I said, learning culture is a very, very important deterrent, which we usually see in our country. The spoon-fed school learning acts as a deterrent. So these are my references. So thank you all.